Chronic kidney disease. It remains to be one of the most dangerous diseases, not just in the country, but also worldwide. Now, as we observe World Kidney Day tomorrow, we take a look at ways on how we can better take care of our kidneys. Joining us now live in the studio is Dr. Maaliddin Biruar. He's the president of the Philippine Society of Nephrology. Good morning and welcome, Dr. Maaliddin, and thank you for joining us here on New Day.
Good morning, Freddie, and thank you for having me here.
Now, before we talk about chronic kidney disease, let's take a step back and look at the big picture, especially here locally in the Philippines. Gaano ba kalala ang chronic kidney disease? How serious is it? How prevalent is it?
Well, we have around 7 million people with chronic kidney disease or CKD, and that's 2021 data. So we have yet to get an updated data on that. And there are around 35 to 40,000 patients on hemodialysis. So that's how prevalent the disease is in the country.
So that's the one of the more serious sides of it. No? That's what we don't want, for the patient to actually rely on hemodialysis in order to filter their blood. Now, madalas na tanungin ng mga pasyente ito, ano ba yung mga signs or symptoms para malaman namin may chronic kidney disease? What are some of the more common signs that a person is having chronic kidney disease?
Well, for a lot of patients, there are really no obvious signs and symptoms. But what we want to really promote now is to be aware of those subtle signs of kidney disease. Like, for example, merong back pain, or there's protein in the urine, or for example, there's tea-colored urine. So that means they're urinating RBC or blood and they don't know it. And then hypertension, diabetes, because those are the risk factors in developing chronic kidney disease. So if you have diabetes and hypertension, may check ka na dun sa list of risk factors. And you may develop CKD if your hypertension and diabetes are not controlled.
So pag ibang kulay na yung ihe, pag meron ng mga diabetes or hypertension, kailangan nang magpapunta sa doktor, wag nang hintayin pa.
Yes. Yes.
Okay. Now, prevention is always better than cure, is what we always want to promote here in CNN Philippines. What are some of the things that our viewers can do para hindi mangyari ang chronic kidney disease?
Well, meron kaming tinatawag na 8 golden rules, and you need to observe that to prevent development of kidney disease. So number 1 would be controlling your blood pressure, controlling your blood sugar, and then drinking enough water, proper diet, exercise, avoiding over-the-counter medications, not smoking, and have yourself checked, especially if you belong to those group of patients or population who have a high risk of developing CKD. So remember, there's no vitamin, walang vitamin for kidneys, and those things that they say can help your kidneys na mga vitamins, some preparations, we really do not promote that.
Okay, so very important points there. Now, tomorrow it's World Kidney Day, and what is the theme for this year, and how will it affect Filipinos?
Well, every year kasi, iba-iba yung theme ng World Kidney Day because we need to educate people regarding kidney disease. But for this year, it's preparedness for the unexpected in supporting the vulnerable. So it's kidney health for all. This theme is really like paying homage to what happened during the COVID-19 pandemic, because we were all surprised and we were all at a loss, and we did not have any systems, for all these patients who needed dialysis, who needed transplantation. So the medical services were really hampered and delayed. And so now we think that we really need to support that, especially that disasters are now increasing in number globally, not only in the Philippines.
Okay, are there any important activities that will be done tomorrow in observance of National Kidney Day?
Well, every year we do it in different hospitals where we all practice. But this year we're going to Cebu to do that, no? And ano ba yung usually we do, because it's really awareness campaign. So merong lay fora, and then there's also like Zumba or exercise for patients who need to be fit, no? To promote fitness kasi. And then also for the first time, we are forging a partnership with different medical societies and some local government units, especially in Cebu, to promote CKD. So we call that Stop CKD, because we want to prevent development of CKD. So we want to screen more people and identify them before they develop CKD.
Okay, definitely information is the key in trying to combat CKD. So thank you once again for joining us here on New Day, Dr. Maaliddin Biruar.
Thank you for having me.